So this is our summer ALR circle update, and I've got quite a few things to talk about. So I'm going to go ahead and get started. And then at the end of this, for those of you that work in the dementia care world, if you want to stay for just a few minutes, I want to share a proposal that came to me last month that I have been considering doing and see if there's enough interest. All right, so this is as close as I got to fireworks this year. So I'm going to talk about things I'm going to call hot ticket items. And you're going to get a copy of these slides, plus I've put in stuff into with Lena that she's going to share with you some other items to help you do some of this work. And so try to don't get overwhelmed. And a lot of this you may have done, some of it you may need to do a little cleanup. All right, so the first thing that happened in July is the Colorado Fire and Safety got a whole new chapter, got it approved and activated it. And so I want you to make sure that you have the new uniform report form, and I have put that in. And then they brought back to life their risk management tool, and they built one, and it's for anything and everything. So you'll see on it, it says schools. But when I talked to them over there, they said it was fine just to use that one, that they didn't have time to make one for every entity that they served. So you have I want you to attach this new form to your current fire drills and fill it out to the best you can, and then make sure you do that risk management one of who's the toughest person to get out, who's the one that could help, did everybody go where they were assigned to, or are you being successful? So 2 more additional things to do. And remember, you have at least 1 fire drill every 2 months, only if you are successful and you meet your goals. If you're not meeting your goals, you need to kick it up and do quite a few until you are meeting your goals. You have 2 nighttime requirements. And so they're going to get really hard on this because we've had some situations happen at night. And with a limited amount of staff and getting people to safety did not work really well. And we just had one this week in another state. And so they will look at that as well, because that particular facility really got flooded really fast, like within 15 minutes. And so they had to get lots of people over there to carry out all of their seniors. So again, look at your current process, how you're doing your fire drills, add this new tool that they came up with. Don't worry about the title on it, and then do your risk management tool at least once or twice a year. Okay. All right, emergency preparedness. I'll be doing a separate recording on emergency preparedness in the next week or so, as soon as we can find time where Lena and I can work together, and we'll put it in our YouTube channel and let you all know. And it'll be more, have more detail than this was. But your fire drills is part of it. And then the second is staff training and resident training. And so you need to address emergency preparedness in all your resident meetings and have open discussions. And that's what they're looking like. So they want you to tackle different topics like, what do we do if the weather gets really bad? Or what do we do if we lose power? How do we help each other if, there's a electric fire? They want you to have open conversations with your residents. The cool thing about it is a subgroup of the national conversation built a kit, and it's on ready.gov. Okay. You need to have an emergency packet. I've got a lot of facilities that got this done for me. And so after working with them, we kind of figured it out. So we just copy the face sheet, those plastic sleeves with 3 holes in them in a notebook is what I'm using right now. And then I've got a couple of communities doing cloud-based emergency packets where it's HIPAA compliant. And then I got one facility doing both. I really don't care as long as you've got it. So you want to do a copy of the face sheet, make sure that you're meeting all the new current guidelines for face sheets. You need your master medication list. It has to be fairly darn current. You need your MOST form, which is the overall directive from the consumer saying, if this happens or that happens, this is my preference. And if they have any more tighter advanced directives, then you can allude to that. And if you can get to them, you don't have to keep them particularly in the packet. You do want to have your durable power of attorney for medical decisions. So this morning on Parker Road in Orchard, I don't know how this happened, but a bus hit 4 cars. And so they had people on the bus injured. They had the 4 people in the cars injured. The bus driver was injured. And so again, the first thing they really need is a power of attorney, who's going to be the voice. Otherwise, 2 medical people take over what they call medical proxy. And I would also encourage you to a picture of that resident. And then if you can get people to do this, if they have smartphones or because you can't do your whole community on your phone, but they can put the Colorado app on. And the cool thing about that, when you get to the shelter or wherever you're going to land, is that you can work with each resident, open their app and get some of their information off the app that will help you with conversation for crowd control and emergency services. And the big thing they're looking for is your COVID information. So another big hot topic is environmental protection. So these folks are now in our industry, and a guy named Clyde Wilson did a presentation here recently. And so basically what they're doing is they're looking at your physical plant. And what they went back to was chemical. And I know that a lot of the houses I go to, chemicals are everywhere, getting them back locked up and all labeled, and having your old-fashioned cards, if you want to do it that way, a cloud-based program, which is available now, and your EPA numbers is essential. So they're making random visits and looking at small and large communities to see what you've got in your house for chemicals. So this all came, it was kind of interesting. So this came from water, and they've been testing water in all the different municipalities across the state, and how infected the water is and compromised, and and all the amount of chemicals in the water, and having to change the water treatment plants to deal with all the disinfectant situations. So, chemicals are not always a friend to a human body. So I would highly encourage you to keep your chemicals very minimal, and check the EPA for the lowest, it's called a ranking system for things you need to do without contaminating the environment. And get this done, check it off your list. Another hot ticket item is OSHA. And so OSHA showed up about 8 weeks ago. And one of the facilities I'm working with actually got all their slide decks. So that was really cool. And I was able to look at it. And so I decided to name this project Pass the Hat. So the health department's tired of COVID, and they're on to other things. And so they passed the hat over for the N95 mask to OSHA. So OSHA has, if you get a outbreak in your facility and you report it, more than likely OSHA is going to show up. And so the toolkit, we got that. And so you have this available in this slide. And now you've got to get all your staff fit. And so we got to spend a lot of time talking to Centura and Concentra, St. Joe's, Denver Health, all the public health is, and who's going to do this fit testing, because it's super expensive. And then so big organizations can train somebody and they can pull this off. If they can keep that staff person as an employee, they can pull it off and get it done. For our small ones, we're going to have to really start either working together or paying Concentra to do it for you. And so right now, Centura backed out when they said they were going to help, and then they said they couldn't help. And so at the moment, OSHA is taking lead. And the experience I've had in the last month is OSHA visited a community that had multiple outbreaks and didn't like their fit testing and their documentation, and not having that oversight. And so OSHA cited them, and then the health department showed up the next day and cited them in Chapter 2 and Chapter 7. So I really would like to get rid of masks. There's a lot of reasons to get rid of masks, but we're not going anywhere fast. All right, one of the things that I've been thinking about is that one of the 3M products is in blue. When you use blue in your community instead of the white ones, you're less likely to get fraudulent made masks. So unfortunately, Amazon and Home Depot, Lowe's, they have a lot of masks out there, but they're not for the healthcare industry. And so they don't have the OSHA stamp of approval. And I haven't been able to find any fake blue ones. So I was thinking that maybe if we just went to the blue, at least visually, it would look like we're trying to do the right thing. And then in your COVID notebook, you're going to add a section, and it's going to be, and I think you can put under 2 as far as I'm concerned, is it'll be your fit test, the date it was done, the results are in their HR record, and what's the size of their mask. And then some of the companies in the Front Range are going to supply the masks to the facilities. So like I said, this is going to be really interesting as we get this going. I don't see it going away. Not that I'm particularly happy about it, because wearing the mask is miserable. And residents don't like seeing the workers in the house with masks on. Residents definitely don't like wearing the mask, and staff really hate wearing the mask. So unfortunately, I don't have an answer how we're going to get this changed back and go back to just blue mask and make it more sensible. The next thing OSHA is looking at is eye protection. So for all your staff, if you gave a waiver or they're not fully vaccinated and following the guidelines that's on the health department's website, they must wear eye protection the whole shift. Okay, you must make sure they've trained. Make sure that they're demonstrating to you how to put them on, how to put them off. They don't lie them down any just old place. There's a process of where they can put them and then how to clean them before they put them back on. And then if some of the masks are only good for a certain amount of time and it's on their product management, and you got to have your policy to match what you're doing. So if the resident is not fully vaccinated, anytime the staff is working with that resident, they have to wear eye protection. So let's go back over this because it's a little confusing. So staff that are not fully vaccinated, they wear them the full shift, period. No discussion. If the resident's not fully vaccinated, then anytime the staff is doing anything within social distancing spacing, they need to have their eye protection on. This is to protect your workers, okay? And then the other thing I decided to look up after talking to my friend in Rome is I wanted to see what the long hauler noise was about, how it's impacting eyes. And because we've had some calls here in the office where people had COVID and then lost their eyesight within a month. And so I was trying to search that down, figure out, is this, an outlier? Is it a trend? Is it something that's going to be going on in the future? And so I found this article so you can look at it. And what I understand so far is most of the people that have lost their vision with COVID either had a really bad case that ended up on a ventilator and was really down for like weeks on end, or there are people that have had multiple impacts of COVID and they keep getting it over and over and over again where it impacts their body. So remember, COVID is not just respiratory. It likes to get in the body and start raising havoc in other organs. So this is why eye protection, again, it's OSHA and then they tattletale and then it'll be state. All right, so the public health order is definitely through October. We got an email on that this morning, verifying that. I got that clarification from state. They are anticipating that it'll actually go through until spring of next year because of all the work that needs to be done. So I gave you the new RFC so you can have a fresh copy on your desktop, gave you the new public health order so you have a fresh copy, and then a decision tree if you do have an outbreak. That decision tree, it's either page 56 or 58, is fabulous. And I call it mapping. But it will guide you through what you need to do. And then if you just follow it and document carefully what you've done, if you do have an outbreak, then you can get through it. So far, there was Wednesday, 184 people in the hospital with primary diagnosis of COVID, and only one out of the 184 came from either a nursing home or assisted living. Everybody else was young people, late 20s, early 30s from community outbreaks and the colleges. So I have a grandson that's a junior, and so they just had first real full week of school. So within 4 days, they had a major outbreak of COVID. They had to send everybody back to homeschool this whole week. And then they all have to have a negative COVID test to come back to school Monday. And that was 1 week of school. So again, this stuff has not gone away. I think our industry is a little further ahead than other industries. But if you do have a positive PCR, pull out this tree and follow it. Please make sure you're testing twice a week. Quit worrying about what the community numbers are, because they'll confuse you half to death. It is the transmission numbers that drives this bus. And so we're still at twice a week. And I totally don't think we will get out of twice a week for the rest of this calendar year. All right, so let's talk about some chapters in infection control that you need to work on. So COVID updates. As you know, I will help you guys. All you gotta do is pick up the phone and call. You also need to do an updated vaccination plan and an updated, and it must be in EM resource when you do your next EM resource, who your contractor is to do your flu shots. And so the department said they would help connect people, but they would rather that you have it together. We just had a morning meeting this morning with some people, and there is a chance that they're going to help us with vaccinations in the market and for all of the small assisted livings. So we'll see if we can convince them that that would be a great thing for them to do for public care service. We've had outbreaks of foodborne, so norovirus and C. diff. So one of your staff meetings, you guys need to review these. West Nile is back in its normal places, Greeley like being one of them, any of the farming areas, not so much in the city. I haven't heard of West Nile in the city. And then wound care is another infection control. So open and draining wounds are not an okay in our industry. That is skilled care. So when home health comes in, and they've got a whole pile of changes that are kicking them in the butt right now, if they can't put those wounds into a contained dressing that can be changed by them in their visits, then we may not be able to keep that resident. And I've had cases where I've had to really work with the PCP office, get a wound care specialty nurse. Those are specialty nurses that train in this stuff, and get that person on board and make get them in stable situation, and then bring it back to the assisted living in a stable situation and get it all documented. Because remember that anything that's open and draining is skilled care, not us. And we've got a real big problem if people have pressure wounds, or they have surface wounds, or there's a really weird rash going around the city right now, that opens up and busts, or monkeypox. And any of that could really impact you. You may need to get some help from a nurse epidemiologist or a nurse practitioner. Get somebody to help you make a good decision on here so that you are in good control of this. Okay. And then document your staff trainings. What do you set people to? Did you give them individual time to do a 15-minute training, or did you do it as a group? Do you have competencies? What are you working on to do that? All right, so as I've been talking about, you're going to revamp your toolkit and keep your testing up, keep your documentation up. And then if you're using any private labs, make sure that that private lab has an approval from Colorado to actually do Coloradoans. There is some labs that are multi-state labs that do not have a Colorado blessing, and they have had some major fines put against them for practicing in Colorado. So cover your butt, make sure that you know what in the heck you're doing. Okay? There's 3 blessed labs, I'm going to call them blessed, that Colorado has on the website, Mako being the biggest one. State lab is closed. They're not doing it anymore. And they contracted with another agency to pick up all their testing. All right, monkeypox. So then again, another state meeting, because monkeypox was kind of, I don't like the word for one, because it's actually smallpox. And it's just a form of smallpox, and it's wicked and it hurts. And what I've seen, what it's done to children, just turns your stomach. And so the kids really, if the kids get this stuff, it's really bad. And we need to, so there's a really good monkeypox training that I'd like you to put your staff through, and I've given you the jump. And really, frankly, I just want to bring awareness to this stuff so that in case there's an outbreak, that they don't bring it to your facility. So if they have any inkling that one of their kids is sick, with any of these blistery type things, ask them to please call you and not come to work. You do not need an outbreak in your facility. So let's talk about another hot ticket item. So what I try to do, I'm a real visual person. Those of you that know me know that. So I'm trying to start giving you guys some what I call mapping. And so this is something you can do if this speaks to you, and to help you talk about it and then follow your own directives. So a whole lot of words on a page just irritates me. But if I can see it in a mapping, then I'll go back and read it. So who's responsible? What's the topic about? What do we need to know? And what do we need to gather data about? That's a form of mapping. As I said before, we have all these agencies just involved now, and they're in our industry thick and thin. So I wanted you to be aware of the different ones that I've identified this summer, and went to meetings and conversations and trying to understand what their viewpoints and focus points are. So HCBS final rules. We started back in 2014 to start formulating a new product for the feds as a demonstration state. I was lucky to get invited to the table, so I've been a part of it from day one. And I'm still trying to stay in the lane. Had a little bump in the road with a newbie over at the department. I just got very irritated and went right to his boss, right to the top of the chain, and said, what's going on? I've been a part of this since day one. Why am I getting this response? And then they had to backpedal and apologize. And they've invited me back in, but I have not rejoined. And I'm not sure I will at this point. The Italian's coming out in me. But in retrospect, though, FAQ 1, 2, and 3 are mandated. I'm going to tape on each one of them. There'll be about 30-minute tapings. And like I said, as soon as Lena can help me and we can get all this caught up, they'll be in our YouTube channel, and you can look at them as you want to. HCBS final rules are good for anybody, no matter how they pay. And the big thing, they're totally about rights protection. So the ombudsmen are super trained in this. All your policemen that come into our lane are trained in this and have competencies. All the detectives that are doing elder abuse detective work, the courts, all of them have went above and beyond where we're at. And we've got to do some catch-up work. So FAQ 1, 2, and 3 are more specific topics that I will cover. And like I said, I've got them all ready to go. They're about 30 minutes each. FAQ 5 dropped last week, and they're going out of their way to correct misinformation, or I don't need to do that. And that's their big focus with this last piece they're doing, because unfortunately, we've had way too many people in our industry tell the state and tell the feds that they don't have to cooperate. And that's how we've lost 200 Medicaid beds since January, and multiple facilities have been closed. Please don't be a victim to that. And I can tell you that rights and rights protection, no matter how people pay you, you must really understand these, and you're going to have to change some of your ways. And it's going to take all of us together to get there. All right, so the big thing in rights is the concept is least restrictive. And so we have to really try to think through this, and it is not easy. Because when you're running a home, just like you run your own house, you have spoken and unspoken rules that you expect people to abide by. I've had a rule in my house for over 25 years that no shoes are worn in my house. And so people that come to visit know that they have to take their shoes off, and I have a great big bin of slippers, and sure, you can put something on your feet, just not your shoes. And so, that is particular to my home. Every home has those kinds of rules that we need to make the work. We have to be careful that the rules are for everybody. So there's a whole big thing, and you're going to see on HCPEF's website, if you want to go look at it, they just dropped it yesterday. They have put out to all members of HCBS. So they sent an email and a letter to all HCBS members to go look at this video they did on rights restriction. So you can't say you can have 2 cigarettes an hour, or you can't say you can't carry a lighter, you have to come and get your cigarette lit by a staff person, or you can't say you can't bring alcohol in the facility. And so we've got a lot of work to do because, again, we're serving people that need some support and guidance around that. And so the only rule that we have 2 rules that protect us from the federal level. Smoking, can't have any smoking inside the building, has to be 25 feet away. Call it Denver smoking rules, Colorado smoking rules, I use them all the time. And then the marijuana and meth, and now the magic mushroom controversy. So they want to make magic mushrooms an okay thing, like marijuana. Last thing we need in our industry is people high on magic mushrooms. So again, we've got a lot of work to do, and it keeps me in this lane of conversation because I am not particularly excited about this free-for-all that they want to start running. So the rule is that you don't, as an administrator, have the right to restrict anybody without going through the approval. And there's going to be some regulations coming out in the next few weeks about how, when you want to do a rights restriction, and how that's going to work, and all the jumps you're going to have to go through to get that accomplished. It's going to really be challenging in some cases. So what I'm working on, and I will find out soon because I'm going to be testing it, is that when we admit new residents that are working on something, that it'll be in their service agreement that they, if for instance, I'm working on one right now, no alcohol or street drugs is part of your conditional living here, because that's what they're working on with the behavioral health and the court system. And so trying to figure out that lane and that conversation and how to put it in writing is part of what I'm in. And then I'm also I've talked to probate court on the state level, and I've talked to Denver probate court, especially about this alcohol thing, because if our residents were able to make good choices about marijuana, meth, magic mushrooms, and alcohol, why do they need to live with us? And why are we spending state dollars? And that's what I've been actually pitching. Why are we spending tax dollars caring for people, but then telling them they can have a free-for-all and they can do what they want to do when they want to do it? It doesn't mesh. So we've got work to do on resident rights, and we have work to do about how we admit people and have it as part of their admission work, why they live at the facility, and yet respect this least restrictive conversation. So this is a poster I found. I thought it was pretty cool. Even though it was made in Canada, I liked it. So I just wanted to share it with you and say, this is available if you would like to use this tool for a conversation about what is the Residents' Bill of Rights. Okay. The next big ticket item that they're working on is resident engagement. And so you need to have on admission and annually an activity assessment. And we talk a lot about it, and I even have talked to Eileen about it recently, that residents use what little bit of money they have, and smoking is a very expensive habit, and they have nothing left to do anything else with, including buying socks or having a decent coat or anything, because they smoke it all out. And so, more conversations about that. How are we going to help people get off of cigarettes and build their lives with things that are meaningful? And so every meeting, in your resident meeting, you need to have on your agenda what kinds of activities or engagement they would like to do for that next period of time between meetings. So you need to start looking at your community. Are you an age-friendly community? Are you a dementia-friendly community? Are you part of anything? Anything's doing some really cool stuff. So I don't know if any of you have paid attention to that Webb telescope that's out with the Hubble photographing the world outside of our universe. And I've seen some incredible pictures. And so I know I've had incredible conversations with some residents across the state, and they really are interested in that. So it's an opportunity to have small groups to look at the current pictures, talk about them, and then look at books and look at the universe, and it kind of gets their attention. It don't cost anything. It's just literally time on the net and time over at the Anythink library system. There's also a program that Xfinity is doing right now called the Master Program. And they have a master class for a week and do a specific topic. So they just did one recently on the Civil War. Can you get some low-cost tickets? I don't know, and Maggie might know this one. We had a program called Art. Oh God, just had it in my mind. Anyways, a philanthropy program, and they would get tickets and then they would pass it out in the community to different events. And I'm hoping those are starting to show back up. So what I'm trying to say here is when in my work and visits, I see people are super bored and they don't have any purpose. What are you doing to fill this gap? And TV's not it. So resident engagement will be scrutinized on your big surveys, and they will look at your activity calendars. And then for those of you that are ACFs as well, there is a little state group going around, and activity calendars is one of the things that they're looking at in resident engagement and how the residents feel about living at your house. All right, so something else that I thought about is building a new, what I call a modern yellow pages, getting the residents to help. Look for things, find posters, what's going on, learn websites, and getting the residents to take some responsibility to help these and then post them so people can make a choice. And it's kind of funny because I've had conversations with people about this. COVID really kicked my community engagement. I haven't hardly been doing anything for almost 3 years. And a lot of stuff's waking up. The things that I've loved my whole life is waking up and coming back, but I'm still not going. And then Eileen asked me to attend this or that event with her, and I'm still declining. So you may have residents that are just not ready. But if they can do something within their own environment, makes them happy, has purpose, give them that opportunity. All right. Another hot ticket item is the grievance process. So it can be informal or formal, and it is a new reframing of the complaint program and having a complaint box, but it's a lot more formal than the complaint box. So you need a form, and there's several. I have one kind, and I've seen several others out there, and the residents can fill them in or staff can help them fill in. Sometimes you can handle these in a resident meeting. Sometimes you got to jump on it and have a face-to-face discussion with that resident and figure it out. Also, make sure that all your families and legal representatives have that form for your house and know the process. You have to post the policy and the how-to in your community area where you have resident rights and house rules, and you must have the forms easily available. They should not have to ask for one. And that's the big thing where I've seen the deficiency written out, is that the resident has to ask for the form instead of them have the choice of being anonymous. The next big thing, and this is where we wasted so much of our time from January to June, was fighting Senate Bill 22-154. It's a really mean bill, and it's totally on our industry. And it was totally written by a legislator whose grandmother died of COVID in a facility. And then the family wasn't allowed to come in and be with her. A pile of other things happened. And this lady's on a mission, and she's ready to write 2 more bills. And so, like I said, this is going to consume us again. If we decide to get on this bandwagon. Otherwise, we may just stick with what we're doing and try to ignore her. But the big thing is that you cannot discharge somebody for behaviors on your own. So you're going to go through a process. I don't care how they pay you. And the health department will be the final decider. So think about what we've been experiencing in our IDRs, and it'll be another thing. I think I wouldn't surprise me if the lady that runs IDRs runs this program, and you will have to present to the IDR, and then they'll decide if you can give them an eviction notice for behaviors. On the other hand, this is the reason I went the other way. What can we get proactive? Can we build in some agreements prior to admission on things that they're working out in the community that got them in this situation in the first place, and that this is part of their agreement to live in your home? And so it's kind of 15 in one and 20 in the other, and it will continue to be work that I'll be engaged in, because like I said, this legislation was a real bummer.
Hey, Pat, I'm sorry to interrupt you, but on that bill, do you know when that's going to go into effect?
It already went in July 1st.
It did.
Yeah.
You know, the problem I see with that is that people are going to be more selective in who they take. And I think it's going to be harder for people to find housing then.
You're right on track. Hey, and I'm encouraging people to be selective. Okay. Heads up, minimum wage goes up again, January 1st to $17.76. So just like you did your attestation forms earlier this year and went to minimum wage, put that in your HR files, for everybody in the Denver County, you're going to need to plan for this $17.76. And so, yes, Bonnie, I've already asked, and we are going to get an adjustment on HCBS from HCPF for Denver County to accommodate this crazy thing. The other thing that I've ran into recently is people having house managers or 1099 employees. Remember that you can have neither in this industry unless they're in management and they can choose their own hours. Or they're a special project person and they only are doing a project. If they're doing direct care provider, they have to be a wage earner and they're paid on per hour and with overtime. And so I've given the web page so you can review those. All right, we have another thing coming at us. It's called the occupational work law. It started August 1st. And so you got to change your policy in your HR and your employee handbook. The bottom line of this dang thing is if an employee has 10 days to report an injury they think they got at your house. Now, in the conversations with workman's comp and unemployment, they're not changing anything of what they're doing. The only thing that rule is changing is the employee has the 10 days to report an injury. And so there's a new poster. And again, it's here, it's for you. Get it. You can order it and there's 6 of them, new labor posters. You can order it from the Department of Labor for free, or you can print them, whatever makes you happy. All right, I want to talk a little bit about this whole chaos of attestation. So attestation is a legal term that has really been thrown around heavy for the last couple of years. And it is your wet signature for a legal agreement. You need all of this list that I gave you right here. You need to have a wet signature with either staff or with residents, depending on what it is, that they have this. So again, this walking in the house and the surveyors ask a resident, where's the house rules? And the staff and the resident says immediately, I don't know what you're talking about. Yes, you do. And so, yes, they're posted here. And here's your signature. You got a copy and it's on the back of your door. Oh, yeah. And this is how we are countering this tag. And that's the big one, house rules and resident rights. And then I added the other things that I've seen. So there is a new regulation that you have to openly talk about internet services, what is available for the community, what is a paid program and that they're responsible to pay to have, or what is a hotspot program that they're responsible. It's got to be very clean in the lease agreement. All right, so as I said before, I'm going to tape some stuff. And I'm also taping a program called Stop. And I was almost done taping it because we had our times wrong. I thought this program was at 2:30 today. And so at any rate, I will finishing that up. It'll be on our YouTube channel. It's for your use. And the whole gist of this is a 15-20 minute discussion to work with your staff to quit saying, I don't know. I need you all to quit saying, I don't know. That's the last thing that wants to come out of your mouth, is you got to take the state stance and say, that's a great question. Thanks for asking that. Let me go get the information that you're looking for you. Or, here's where it is kept. So like when you're signing in your visitors and you're doing your checkoff list, and you take the temperature. Sure, it's right here. This is how we do it. This is our procedure. And you take charge. And this is, I'm hoping, if I can get as many facilities off of this I don't know wagon, that we can knock down these POCs and decrease the power game that we've got going on. So in the request bucket that I've been sent by different administrators across the state, this is some other things they've asked me about. And so if you have anything, or you're looking for things, or you're trying to figure out how to do it easy and straightforward and consistent, you know, the door's open. Don't have any problem talking to you about it, helping you think it through, and then finding tools that are already vetted and you know, working, or help you build a tool, whatever you need to be successful. All right, so last thing. At the last meeting for the industry, Dee Rita presented a new thing that she's been tasked to do, because she was reassigned from her old job to the new job. And so she's working on production of clues and hints in education using Chapter 7 guidelines. What I saw was really good, actually. And so she was getting feedback. My only problem with it was the people that she was allowing her to give feedback are not active administrators. So I was a little irritated with her about that piece of it. And she was blocking people that actually do the work. But it's coming out, and I think it'll have some value and some meaning that will help you. The better thing that came out of the meeting is because Elaine got promoted, and we got to meet Steve Cox. So Elaine's job required that you be an active RM. So that's why Dee did not get the job, because she's not an RM. And so Steve came and he introduced himself. And so I look forward to talking to him more and working with him. I told Eileen I felt like we had a little chance of doing some repair with the department, and because he seemed more approachable than anybody's been over there for quite a while. Want to give you a couple other little quick tidbits. A whole pile of news, including local news, national news, that the people in SSI are getting extra money. They are not. They're just getting paid a day early. And then last but not least, every one of your residents in all your homes is eligible for $750 from the Tabor Act. And so I've given you the form. And on this page tells you exactly what they need to put in. And then line 28, they need to know what their gross Social Security income or SSI or SSDI, whatever it was. Fill that piece of it out and sign it on the back of the page and mail it in. They won't get the money. I don't think they'll get the money before the end of the year. I suspect it'll be January when the new cash funds come in. But Eileen fought like crazy with the state, and we won. And so every resident in nursing homes, every resident in assisted living, all of my people that, you know, live in low income, all of that, we're working and getting this information out to make sure that they are part of this rebate, because they may not have worked and paid taxes, but they pay taxes in goods and services. So please make sure that your residents or their families know that this is an opportunity for the 750. All right. So now let me look at the chat and see what's in here, answer those questions. 154 is in effect already. I do have the new rates, and you do have to have your smoking area monitored one way or another. Especially if you're an ACF with high-risk clients. And Maggie, I don't have a clue how you're going to do it any better than what you got right now. I agree about the dang mask, pain in the ass. Okay, and then Lena's will tell you how to get our YouTube channel, and it's Colorado Gerontological Society. We have quite a bit on it. I have quite a bit on it. And like I said, I've got 5, 6 things more that I'm going to drop in there so that you can have them at your leisure and catch up. So for those of you that want to leave, that'll be perfectly fine. And if you're in memory care and working in an industry, if you would stick for a couple of minutes, I want to find out if there's enough interest to develop another ALR circle for memory care, because I've been thinking about it for a while and I've decided I'm willing to do that. And then I can, we've got a couple of minutes, so I can take any live questions if any of you have any.
So Pat, I just have a question. You said you've been taping the FAQs right now. When
they're getting ready, they're ready to be taped. I'm going to tape them. Hopefully, if Lena's got time, I'll have them taped by Monday.
Okay, and then will you send out a notice that they're available on the website?
Yeah. So if you got the ALR Circle email, it'll be on that same MailChimp thingy that Lena does.
Okay, great.
And then I think I'll put it in Facebook as well for those of you that follow us on Facebook.
And then just an FYI, I'm not at liberty to say which facility, but I just heard from an administrator who had 4 surveyors in his facility for 2 solid 8-hour days.
Yep.
And
that's pretty common if you've got more than 10 residents.
Yeah. And he got like 36 deficiencies, where in the past he's never had any deficiencies at all. So
well, if you talk to Maggie, he may want to reach out to me. I've written so many of these that I've got standard responses ready to go for many of them.
Okay, I'll tell him that. He he's just dumbfounded because they're short of staff and they're trying the best they can, and then they're coming in and being really nitpicky and stuff that 5 years ago wouldn't have made a difference. Today it's even worse because of COVID and all the extra precautions we have to do, and then they're really digging down. That doesn't make any sense to me at all.
Well, again, we're in a very weird time in our industry. And that's part of what drives Eileen and I, is that we're trying to get course correction and get it back to some common sense. This is a people's homes, and we are not institutions, and we should not be at the same level of nursing homes or hospitals. So it's going to take a whole lot of pushback. We're one of the few states that ACFs or ALRs under 19 people are even having to do any COVID at all.
Yeah.
States are not doing anything for the small homes except for once a month testing. So like I said, it's mind-boggling why Colorado thinks we need to do all this highfalutin craziness.
And I agree with you 100%. My residents and my staff are really getting tired of it. It's, physically draining as well as mentally. And I don't understand why they're still monitoring it. And it, as you said, it is becoming more institutionalized. You have to have these posters up all over the place, wash your hands, do this, do that. I mean, you don't do that in your home.
No, I hope you wash your hands in your home, Maggie.
But you don't have posters.
No.
To remind you at every sink, make sure you wash your hands. It's crazy.
Maggie, I agree completely.
Yeah.
It's
so for those
the
of you
resident rights have
Kendall,
gone
she's
out the
also
window.
an RN. Go ahead, Kendall.
Oh, I just said I really just feel like it's so sad because the resident rights that we preach and we act and we do have all gone out the window.
Well, and that's why I think it's going to take an organizational change. And so Eileen's working on that. They just had a major meeting with all of the different groups, Leading Age, call all of them, spent a half a day. So I'm going to trust Eileen to work on that area because she's really good at it. But we've got to get them out of the way because we're not the enemy that they keep trying to make us.
Right.
We truly aren't. We want to do what's best for our residents. Mm-hmm. But it's hard when more and more, especially Medicaid facilities, are closing because we don't have the funds. We don't have the resources that we need. And they keep adding more and more regulations, which is really cost prohibitive in a lot of cases. So I know I'm preaching to the choir, but I have to say, Pat, thank you for all that you and CGS do. I mean, I really stay up on things because you help do that for me. So thank you so much.
You're very welcome. All right. For those of you that want to hang for a few minutes and talk about the memory care administrative circle, please do. And for the rest of you, I will have another ALR circle probably late September, early October. We'll send an email out and let you know that I've dropped the things that I told you that are going to be in our YouTube channel. And then we're just a phone call away. So, feel free to pick up the phone. It's perfectly okay, or email me. Many of you do. And I'm perfectly happy to help wherever I can.
Thank you, Pat.
You're welcome, Kayla. See you later today.
Okay, see ya.
Okay, for those of you that are still on, several, and none of the administrators that asked me to do this are on the call, of course, asked me to build a new ALR circle for dementia care because we've got more work to do in that area because it is a national anxiety attack is the best way I can put it. I think in talking with Eileen, and actually this meeting that Eileen and I spent our morning at, I think we're going to end up having another layer of dementia care. So we're pretty good at early dementia care. We're those of folks that really like doing the dementia care in the secured unit area are better. And we're missing the middle. And other states are way ahead of us at delivery. California and one of them, Oregon's another one, Idaho, and then the South Carolina. So I've been looking at different things. So when this next thing comes out is, and I'm probably going to, if Lena can, I'm going to ask her to take this slide, Lena, and send it out in a separate MailChimp and ask people to give us feedback in these areas. If you can figure out how to do that, that'd be great. Because it looks like this is what we're really going to have to tackle. I've spent quite a bit of time working across. I really like Tifa Snow. She's still my favorite, but talking to other people and looking to see what some of the best practices are and what are the best tools and how can we get the neuropsychiatrists to help us? How can we get the hospitals more engaged in this conversation instead of just labeling everybody with dementia and bladder infections, and which mean nothing anymore. And you know, how do we do this? So you will get an email if you are willing to help join this. We'll have to figure it out. I don't have any particular format at the moment that I'm married to, but I would like to open up this conversation and figure out how we're going to do a better job of taking care of our memory care communities and protecting the rights and protecting them from the department who's going in and has zero experience or any medical knowledge or any credentialing on engaging what is cognitive and dementia and risk management. And the FAST form is the best tool and actually is all spelled out, and demanding the facilities dismiss people out of secured units immediately, like within 24 hours. And so we've got, you know, it's another one of those headaches that it's going to take a lot of work to figure out how we do this, because we need memory care, but we also need more middle memory care and more programming and money to take care of people. So at any rate, if you are willing to be a part of the circle and help be a think tank, this is what it's all about. And if you can pass this information to people you know, and we can get them to do it. My thinking right at the moment is that we'll do 30 or 40 minutes the ALR circle, and then take the next 30 to 40 minutes and concentrate on memory care. Or if there's enough interest, make a separate day and have a full hour. It just depends on what the industry asks of me. I'm willing to do either one. So what do you guys think, the ones of you that stayed on the call? Don't all talk at once.
I think any way we can help each other is great. So
would you
this is very just an informative to me, Pat, because I am just in the process of looking to move one of my buildings to secured because we have no memory care out here. And I am having such a hard time placing people that need that higher level of care. So I would take any education and support in that way.
Okay. And Kendall, if anybody can pull it off, it'd be you. Just so you know, a brand new memory care in Loveland did just open up last week. So if you need an emergency transfer, they're brand new.
Oh, wow. Okay.
Yeah. So it's called Bethesda, I think, Kendall, and
Okay.
they're in Loveland.
Okay. Great. Thank you.
I know nothing about them other than they opened up. I have not reached out to see if they would join us and be a part of the conversation.
Okay.
So Maggie, let me ask you a question, because you deal with this probably more than anybody I know. You have some older residents over there that not only have long-term mental health disorders that are severe, but they're also showing signs of dementia. what's your breaking point when you no longer can take care of them? I lost Maggie. Okay, well, hopefully she'll come back on. Jason, can you tell us a little bit about what you do for Family West?
Can you hear me?
Yes, now I can. Thank you.
Hi, Pat. So
Hi.
I'm Jason Davis. You actually came out and worked with us a number of years ago on the quality management program for Family Health West. So
Okay.
at the time we had a nursing home, a 70-bed nursing facility. We had a 70-bed assisted living, primarily Medicaid, and a 26-bed private pay secure memory care building. Since that time, we have closed our nursing home as well as our 70-bed Medicaid facility, but we still operate a 26-bed memory care.
Okay.
We are affiliated. What's that?
Are you in Fruita?
I am in Fruita.
Oh, okay. I was going, I think I know this voice. Okay.
Yeah.
Yeah, I think about you guys frequently. I did not realize that you closed the nursing home.
Yeah, we closed the nursing home in 2017. And then through COVID, we struggled with staffing in our Medicaid facility. And so we made the decision to close that facility.
Right. And you'd be willing to help us build this circle and see what we can do collectively together?
Yeah, I'd be happy to help.
Oh, that'd be awesome. Okay. And Tony, how about you?
So Tony's the active director of daily operations over in our memory care setting.
Okay. So the two of you would come and help us be a part of this circle.
Yeah, we would help.
Okay, awesome, awesome. Nice to hear. And Linnell, how are you today?
I'm doing good, thanks, Pat.
And what do you think? Do you think it would be useful to have an ALR memory care community?
I do. Okay.
Jason, do you still have my email?
I do still have your email.
Will you reconnect with me so I can get you back to the top of my contact list?
Yeah, absolutely.
Okay, appreciate it. And Kendall, is this going to be in Yuma?
No, in Sterling.
In Sterling? Okay.
Yeah, one of the two, I bought the Beehive last year, and so it's two houses, you know.
Yeah.
So I'm going to make one of the two secured.
I probably should drive out and see you. Give me something to break a monotony, right?
Come out here to the simple life, Pat.
Yeah.
That's not so simple.
All right, simple. I don't know how simple it is.
Oh boy.
All right, gang. So thank you for sticking on. I think, you know, we'll push this on through, and then we'll see if we can get this thing launched in September and figure out how to make it useful for everybody that wants to be a part of it. So thanks for hanging out, and we'll get you the slide deck and the stuff in an outreach email either late this afternoon or tomorrow, okay?
Thank you, Pat.
All right, bye guys.
Bye.
Hey, Pat.